Good evening and welcome to Hatching for Health with your host, Jessica Hatch. Today we are going to talk about the heart. Today is actually known as World Heart Day. World Heart Day is a global campaign during which families, individuals, and governments all around the world gather together to participate in activities to take charge of their heart health, not only for themselves, but for others as well. So today we're going to have a special guest on, Dr. Asif Ali, to talk prevention of all things with heart health. So welcome and thank you for being here.
Jessica, thank you so much for having me on today.
Yeah, it's very special that today's the day that it worked out, and it's all about what you do.
That's right.
Yeah, so I know you are huge in the preventative side of cardiology and the heart. So I want to start with that. Your background obviously is very important. You have a list of, being a clinical assistant professor at University of Texas Health Science. You also have authored many academic journals, and you present at national and international meetings as a faculty speaker. So let's kind of start there. That's a mouthful to start with. But tell me a little bit about your practice and what your main goals are with your patients.
Absolutely. So I'm a clinical assistant professor at UT Medical School, and that's my foundation, which is academic medicine. And I'm a partner at Houston Cardiology Consultants, which is a private practice. So I've been able to kind of bring both the academic and the private practice together as a whole. But my focus, like you said, and it is a global day to really reflect on prevention.
Correct.
And so what do we mean about prevention? So in fact, in medical school, most physicians are really trained to diagnose and treat you for a disease. But the whole point is, how do we actually prevent the disease from happening in the first place, right?
Exactly.
So that really goes back to knowing what is causing the disease. And there was a really good article that came out by these two authors, McGinnis and Fogarty, in the National Institute of Health. So we've probably heard a lot about CDC and the National Institute of Health. Well, back in 1990, 2000, and 2010, every 10 years, the government was doing a census on actually why we die. And that's kind of morbid, but it's really important to know.
Of course, like where did it stem from?
Right, and where it stemmed from. So what I found interesting in those 10, and this is over a period of 30 years, and they do this every 10 years. So the national government goes back and looks and says, what in the US can we improve? Well, it showed that still heart disease, heart attacks is still the #1 killer in America.
I was reading that.
Right?
I don't know that it's ever not been, right? It's like cardiovascular disease has been the #1 killer for as long as I've been able to Google that information. It's an ongoing.
And as a nation, we've done pretty well in decreasing heart disease, but we've actually seen in just the last 2 years an uptick in heart disease. So again, still in women and men, and I want to make sure women know this, it's not cancer, it's actually heart attacks that's still the #1 killer. The #2 killer is cancer, so we definitely want to do prevention, which we do, right, in cancers, get your mammograms, pap smears if you're a woman.
Of course.
In males, there's other preventative services that we do, but heart disease still in males and females is the #1 killer. #2 is cancer, and #3 is actually strokes or vascular disease. But guess what, Jessica? These are effects. These are not the cause. So in that study by the NIH, they said the cause is the following. One, inactivity, right?
Okay.
So especially now during COVID, what are we all doing?
Less activity,
Less
sitting
activity.
on
We're sitting. We're doing Zoom calls. Sitting is the new smoking, okay?
Yeah.
So we're sitting more, we're not eating enough fruits and vegetables, and we're not getting the amount of sleep that we should be getting, okay? And we're stressed out. And when we're stressed, we increase cortisol, we stress eat, and we sit more, and it becomes this really big cycle of increasing the effect. So we need to get to the cause, which is the prevention part.
Of course. So that's like a perfect series of what is going on right now. And when you say the last 2 years, I mean, most of this year has been COVID related. So I'm sure that plays a big part of that, of those numbers and statistics. So tell me, when a patient comes to you, like, what are those things? Because it is usually very clear with cancer. It's like they do the mammograms, they do the prostate check. There's these different things that
That's
are
right.
very the obvious, but with cardiovascular, I mean, obviously you can say, are you exercising? What are you eating? But
Right.
I guess kind of walk me through, like, how does that go when a patient comes in and
Sure.
your main objective with them with that preventative measure?
Yeah, so it's a three-step process. So first, it's listening, and we talk about just trying to get intake. So it's really important when I talk to a patient, where are you on that spectrum?
Yeah.
And prevention is not just diet and exercise. So we'll get into that in a second. But first is understand where are you? Because when we talk about heart disease or vascular disease, we're talking about risk. And so we try to categorize you. Are you a low risk heart person? Are you intermediate? Are you a high risk? Because based on your risk factors, we can stratify you and tell you these are the goals that you need to attain. So what would be a high risk patient? Someone who has hypertension, cholesterol, diabetes, they may be overweight, they may be smoking, they may not be exercising. And so all of these risk factors plus genetics, right? So if they have a family history of heart disease. So these are really important things to even know as individuals.
Yeah.
And so that's the intake part. And then the second stage is to do the actual testing. So based on your risk factors, we would look at what kind of test do you need? Do you need, for example, I break down heart disease into 3 columns. So we may look at the anatomy of your heart. That's called an ultrasound of your heart or an echocardiogram.
Okay.
So that's the anatomy. Then physiology means your heart under stress. So we may do a stress test if you're an intermediate or high risk patient. And then the third part is blood work. And so we see what is your body doing, what is it made of, how's your cholesterol.
Okay.
Those are really important numbers to know.
So this should typically be a part of someone's, like when someone says, I'm going to go get a physical, I typically think of, you go to the family practitioner,
Right.
you know, they do their different tests, but it's almost as though like that visit should be with you.
Well, I think
so
that,
I'm trying to, you know,
yeah.
because a lot of what is being, you know, done there would then lead to what else would maybe need to be completed in addition to that physical. But, you know, maybe I'm kind of going down the wrong direction, but.
No, that's right. And then it's, so we shouldn't even stop there, right? So we shouldn't just get the intake and do the test. And the last part is really, what did those tests show?
Yeah, like applying.
And actually coming up with an action plan. And I call that education and awareness. So you need to get all the education and what are your options. And I think that's really important who you pick as your physician, because physicians may be limited with technology or options that they may be able to give you. And so it's really important to, you know, look at what your physician, who your physician is going to be, and is it a right fit for you? Because I really think I'm a very big patient advocate, and I want to touch upon that for a second, but you know, patient advocacy, being a better informed patient, and I'm a big patient advocate, so I'll just give some tips to the listening audience, how to be a great patient to help you, because you have to be your own advocate at the end of the day, right?
Yeah, kind of like what, you know, talking about the World Heart Day, it's about individuals actually taking action and doing the activities, you know, to take charge of their heart health. And that's what it's about. I mean, advocate, taking charge.
That's right.
Is, you know, it's not going to get done just by the words they learn from you or the diet, you know.
That's correct. So we really talk about ownership. And as a patient, how do you take ownership and have a better experience with your doctor? So, and that actually plays in with the prevention, because again, back to point number 1, I only know as much as information you give me. And then based on the information you give me, I have to go seek out other tests. So how to be a better patient and have a better interaction with your doctor. So number 1, make sure that you write down all of your past medical history, past surgical history, and not just write down your medications, physically bring your medications to your doctor.
Yeah.
Sometimes there's a lot of miscommunication. Sometimes between doctors, you may have duplicates. And I always actually look to make sure you're taking the right amount of pills and that you're actually compliant on the medications. And then number 2, so after you've kind of written those down, make sure that you write any questions that you have before you come. Because many times by the time you get to the doctor, they're giving you so much information. By the time you're done with hearing the information, you've forgotten all of your questions.
Yeah.
So just make sure you write your questions before you even come in.
Yeah, like
talk
just
to family
prepare.
members.
Like,
Yeah.
that time that they get with you is so valuable, and it's making the most of it. From, you're there to give them all the facts and whatever you can do to help. So it's better they can prepare, the more efficient it's going to be, and the more they're going to get out of that time spent, right?
Absolutely.
So I think that's very important. Now you have a few different offices actually. So you are on the move. You're located, I guess, kind of right in the center of Houston, Upper Kirby area.
We have an office in Upper Kirby area. We have one in Spring Branch area and one on the north side. And what we really kind of tell patients, we're bringing the Texas Medical Center out to the community.
Yeah, because going all the way, to Spring Branch, and then, kind of going to these different areas. Sure. I think that because it's getting an appointment with you guys is I say you guys as in the cardiologist, it's not easy. I mean, y'all are very busy and booked up, for weeks at a time sometimes.
So we try, look, we really try our best to get people in, and we talk about, I was just telling you a minute ago about better ways to communicate. So communication is the key. So we've actually set up a way to text us through a HIPAA-compliant text program called Curegram, and that allows us to be able to do intake forms, especially during COVID. We can actually send our information packets out to patients so they can actually fill all their forms they used to have to do in our office on their phone, sign it, and it goes into our EMR and schedules them an appointment.
Oh, that is wonderful. We are going to take a quick commercial break, but I want to talk more about that. I saw that on your it was on LinkedIn, so I want to get this feeling of that and make people aware of it.
Sure.
So we're going to take a quick commercial break, and we will be right back with Dr. Asif Ali. I love being able to use this repair moisturizer. It even includes retinol. And the last cool product I love to finish with is the Glow Serum. When I'm sore after a tough workout, the Muscle and Joint Body Cream by Cool CBD gives me all the relief I need. Here with Infinity Diagnostics, located here in the heart of Houston. Follow me in, I'm going to show you our MRI machine. We have a 1.5 Tesla Siemens magnet. We're able to perform imaging on your spine and multiple other areas. So please come give us a visit for all of your MRI needs. Being diagnosed with a scary sounding disease can be frightening. Imagine what it's like for your child. There are over 7,000 rare diseases around the world affecting children. Join me, Jessica Hatch, along with leading experts to help break down medical lingo, explain why and what their little bodies are feeling. Real faces, real stories, and expert advice. And you can watch us on the biggest South Asian TV network in North America, NTV Houston. Hi, Jessica here. We are in our sleep center on the second floor of Infinity, and I wanted to show you a little bit about what we have here and what to expect when you come and have a sleep study. We have a lovely setup here for you so you can feel comfortable and feel right at home. Our technician will walk you up and he will connect you to all of the electrodes so that he is able to get the correct diagnosis while you sleep. So if you are having any sleep problems, please come visit us at Infinity so we can help you and put you on a pathway to better sleep. Welcome back from the break. We are being joined by Dr. Asif Ali, and we are talking heart health prevention for the most part. So Dr. Asif, he has authored a cardiology book published by McGraw-Hill, which is something I highly encourage to check out. He has been featured on Dr. Oz, Fox and Friends as a medical correspondent, and so many others, Discovery Channel. So we are really lucky to Hatching for Health to have him here with us. Before the break, we were talking about a unique app that patients are used. It's HIPAA compliant. and it's called Curogram.
Right.
Okay, and spell that for me.
Curogram.
Okay, so Curogram.
Yeah.
And so it's a great app to download. This is something that I guess if your doctor is a part of it, they can access you with text messages, uploading medical records. Is that right?
That's right.
So this is a quicker way to get an appointment, I would assume, as well as just kind of have you at their fingertips to communicate with. What's the timeline of being able to correspond?
Yeah, so actually the text messaging, which is really the preferred way that we like to communicate, because people get so many robocalls and emails, but when you get a text message, you actually look at it. So that's one part of Curogram. But the second part is, right now you can book an appointment to get a flight, get a hotel, get a haircut, but isn't it really interesting that we can't do that with healthcare providers when we need health at the time that we need our healthcare? And so Curogram really came in to help with that. So we've been actually utilizing that in our office for about a year. And that's why I was kind of smirking a little bit about a 2-week wait time. Because of Curogram, we've been able to really process patients and communicate much quicker.
Yeah, if you can get them to fill out paperwork, and truly use that app. Because when you get emailed, the paperwork, you've got to sometimes print it. If
That's
you're not,
right.
There's so many little boxes,
That's
like
right.
using a DocuSign or something like that. It's this is probably set up in a very clear and precise
very easy
manner.
way. A text message, you click on it, you can put in all your intake form, sign your HIPAA compliant, sign your medical release information.
I'm gonna have to sign up after that.
Yeah, no, absolutely.
It's great, yeah.
And I'll tell you a story that actually happened in my office because of Curogram.
Okay.
So, access to care is a big issue, and communication, just like we're talking about. So I remember there was a patient at 4:30 on a Friday. I mean, think about calling a doctor's office at 4:30 on a Friday. They'll give you an
you're
appointment.
like, I'm not going to get an answer, but let me try it.
That's right. And so he knew that, so he did a Curogram and was saying, hey, I have the flu. My primary care doctor just diagnosed me, but I want to make sure that I can go on my cruise on Saturday, which was the next day, and just wanted to get your blessing. And that literally was the Curogram message I got. So I said, get him in, we'll do an EKG. I'm sure everything's going to be okay. Well, it wasn't. He had a big EKG change. Long story short, he ended up having to go to the heart lab, and he ended up having an LVAD, which is an exterior heart, and he needed a heart transplant. So if he had even tried to get on the plane or get on the cruise, he would not be here. And so, we need to have better communication apps and ways to reach our healthcare, because not being able to do so could really cost a life.
I know, exactly. It costs a life, if you think about it. That's a huge impact that made for him, obviously.
Yeah.
Is there, and that's interesting when you tell a story, because I was going to ask you, is there, I'm sure in your position, you probably had a lot of people that have come in and had just situations where it's a blessing and you're fortunate that they came to you and that you were able to catch whatever was going on. Is there any stories that you maybe have in mind that you could share with us?
Yeah, absolutely. So a big reason, just going back to the first segment, that I got into prevention was because of this story. So Arthur was, and he's signed off on a HIPAA release, but he was a 32-year-old and he weighed 716 pounds. And he had to take 2 buses to just come see us. He had Googled us, saw our reviews, and said, this is the person I need to talk to.
Yeah.
But by the time he came to the front desk, he rang the bell and he went into sudden cardiac arrest. He actually literally died in the waiting room. So I was pulled out of one of the rooms and I rushed out, and I was able to perform CPR and actually shock his heart back to life. And when he woke up and he looked at me and he said, now what do we do? So no bariatric surgeon would touch him. The weight limit on the heart lab is 500 pounds. Couldn't do that. So he looked to me and said, what are we going to do? And I said, well, it's called prevention. So we're going to have to get you to lose weight. So without any bariatric surgery, without anything, he lost about 450 pounds as of 2 weeks ago.
Oh my!
And it was a big national story. Fitbit picked it up. Fitbit actually sent us both watches so I could watch his progress. And 2 years later, here we are. And that's why I'm such a big advocate for patients like Arthur to really get to the cause and not just diagnosing and treating, but fixing the cause and preventing it in the first place.
Yeah, no, that's a beautiful story. I'd love to maybe one day have you back and have him join you and just kind of talk about, from that moment to where he's at today. That's incredible. And anyone would love to be able to tell that story. Obviously, be the person that made it happen. So there's a lot of other things that you're doing. I know with Hatching for Health, a lot of the families that we have on, their children with these, rare diseases, disorders, disabilities. Our goal is to create awareness for them, hopes of finding cures. And I know I talked to you a little bit about before the show, and you mentioned there is a rare disease that you actually treat. They start out as children, but once they get to a certain age, they get referred over to you. And it's, what is it,
Dysautonomia.
Dysautonomia.
And you're right. So, what you were saying, autonomic nervous system. And so dysautonomia, and some people know it as POTS, which is postural orthostatic tachycardia syndrome. Really long words, but I'll break it down for you. So we tend to find that it is more predominant in females, usually childbearing ages. So talking about somewhere between 13 to 20s, but can be seen even older. And what the syndrome, and it really is a syndrome. So if you think about when a patient presents with a lot of symptoms, so foggy brain, lack of concentration, the big one is syncope, which means that they actually pass out unexpectedly many times, dizziness, foggy thinking, going to the heart, fast heart rates, sometimes slow heart rates, but typically really low blood pressures. So where the blood pressure goes so low that the heart rate has to go really high to compensate. And then it also affects the gut system. So we typically see that these individuals, they get full real quickly, or they have stomach aches, and they may have even something called irritable bowel syndrome with that. So so many different systems.
I was going to say, that seems so hard to diagnose.
Right, and it is, but I've spent about 7 years in research and understanding this, and we talk about the word prevention, but I'm also very intrigued with what's called integrative medicine. And integrative medicine is integrating all these different organs to understand what's going on with someone. So when someone has a lot of symptoms, anxiety, stomach issues, palpitations, many times it's not that you have 10 different diseases. It's usually one disease that presents with a lot of different syndromes.
I see.
And that's what dysautonomia. Dysautonomia is a heart, neural issue where there's an imbalance between, so the autonomic system, autonomic means you cannot control it. So you can't control your heart rate, you can't control your blood pressure. So there are two components of it. One is known as the sympathetic system, which is your fight or flight. It's adrenaline. It's what makes your heart rate go fast. If you had a snake that came across the floor here, your body is going to go into fight or flight mode. Because you're going to create adrenaline, and your heart rate and blood pressure are going to shoot up, and you're going to try to get away from that situation, right?
Exactly.
But the body also has to counterbalance that, and that's called the parasympathetic. And that parasympathetic usually involves something called the vagus nerve, which is in your stomach. So now you have the sympathetic on one side, fight or flight. You have the parasympathetic on the other side that decreases the heart rate and blood pressure. Dysautonomia is an imbalance between these two systems.
Oh, wow.
And it's very treatable. The problem is a lot of doctors either have a lack of awareness of it or just are not specialists to treat it. And so the typical patient that sees me has been to 7 different doctors.
I was going to say, so what's typically the youngest that they're diagnosed with this, would you say?
Sure. So we see this as young as 12 to 13-year-olds. And even sometimes younger, but typically we really see it in those childbearing ages. And it can be very disabling. I remember my first patient that I saw for this had been homeschooled their whole life. They just had this dysautonomia issue. And as soon as we treated them, they were able to go back to school. I remember the mom coming back and
incredible.
saying, it's just amazing turnaround.
So it's so important for them to, get that right diagnosis and be able to get in a program.
That's
'Cause
right.
the one that you guys have, it's UT Physicians.
So UT Physicians has a great dysautonomia center, but they only take patients up to a certain age.
Okay.
And then once they're adults, typically I will see those patients
Okay.
moving forward.
So you're part of, I guess, that program at the next stage of it. So they're seeing them, at the younger age, and then it comes to your practice at a certain age. Is that 16, 17? What?
16, 17, generally if you can drive to my office, I can
Okay.
see you. So it's
Okay.
usually around 16-year-old. But it's so important that, patients get right diagnosis.
Mm-hmm.
And many times physicians will say, at the end of all this testing,
Yeah.
we haven't been able to figure it out. And so it must all be in your head. And so many times patients are just told it's anxiety, it's in your head. But, if you're at a point where you're like, I know my body, I'm having a lot of different issues, gut, heart,
Yeah.
brain, it may be dysautonomia, and it may be a subset called POTS or postural orthostatic tachycardia syndrome, which is just one type of dysautonomia, but it's something that you may want to get checked out.
Yeah.
And it's something that I'm very passionate about. I've helped thinformations of patients from around the world.
That's amazing. So if a patient wants to, reach out and see you, I know that there's that app, and then your information is online, Dr. Asif Ali, cardiologist, Houston, Texas.
Yes, that's right.
And what is your website? Is it?
It's hccheart.com.
Okay.
Houston Cardiology Consultants.
hccheart.com, Houston Cardiology Associates?
Consultants.
So
Yeah.
Houston Cardiology Consultants. Great. So they can, go on there, learn more about you. We'll obviously provide the links and stuff,
Yeah.
and any information too that we can share with them to be able to get this book. And it's been a blessing having you here.
Yeah, thank you so much.
Our time, it feels like we just started. I feel like I have so many more questions, but I think this is great from the preventative side, and then also learning about this rare, disease that you are assisting with. Like you said, so many patients that you're treating with that and helping them have a better life. So thank you. And again, we'll be in touch, and we hope you have a great rest of your week. And thank you all for tuning in to Hatching for Health, and we will see you all again next Tuesday night.